All right, welcome everyone. I know there are still going to be people trickling in since it's only 12:03, but welcome to the LiveWell seminar on biological dentistry. My name is Jennifer Loxog and I'm the Assistant Director of LiveWell. LiveWell is the Center for Health Education, Promotion, and Advocacy here on campus. We're a division of Student Life. All our services are free to students, and then we also have the 2 UW confidential advocates in our office that serve all staff and faculty across 3 campuses, and then UW Seattle specific students for any Title IX related issues. But along with confidential advocacy, LiveWell does campus health promotion, prevention, early intervention work. And that is why we are so happy to have Dr. Beer here from Integrative Dentistry to talk about the connections between our dental health and the rest of our well-being. That's right up our alley as a health promotion office, is helping educate students, staff, faculty on the myriad of ways that our health is interconnected. So I will go ahead and turn it over. Just a quick reminder before I give it to Dr. Beer to please make sure you are muted. And if you do have any questions throughout the presentation, please put them in the chat. I will monitor that. And then at the end, if we have time, I will pose those questions to Dr. Beer to answer. So I think that's all the housekeeping things. Dr. Beer, take it away. Thank you for being here.
Thanks, Jennifer. Happy to be here. These are topics I love to talk about. And I did want to just divulge that I'm a bit nervous in public speaking scenarios. So if I awkwardly stutter at some point in this process, that's because I'm channeling like 10-year-old Brownlee right now. But anyway, we'll kind of get into it. So I want to talk about the connection between our mouth and the rest of our body. I've titled this the oral systemic connection. And what does the word systemic mean? Systemic means relating to a system as opposed to a particular part. So what system am I talking about when I talk about the oral systemic connection? I'm talking about you. Your mouth is one part of a system of things working together in an interconnected way, a system that, when working properly, is you. This should really say the oral you connection. And what does your mouth do for you? It allows you to eat, which begins digestion, which nourishes your entire body, to speak, communicate, collaborate, relate to everyone you know, to smile, laugh, express ourselves, and enjoy all of our favorite emotions. So it's a pretty important system, right? You take care of your mouth, so it will keep doing these things for the system, for you. But in addition to being important, your mouth is also kind of weird. It's weird because it's the one place where a doctor will cut something out of your body and put something artificial back in to live there for the rest of your life. I'm talking about fillings, crowns, implants, root canals, right? What are fillings made of? Metal or plastic? What are crowns made of? Gold, porcelain, implants, titanium, zirconia. None of this stuff is natural. None of this stuff belongs in your body for decades. And yet it's necessary. Cavities need to be filled. Broken teeth need to be capped. Lost teeth need to be replaced. Why? To avoid the disability of not having a working part of the system. So we need to be responsible with the materials we are in a very real way implanting in your mouth, in your body. The mouth is also weird because, as research has now proven, gum disease is a major cause of systemic inflammation for basically everybody. Studies actually show that between 50% on the O end, that's 50, 50% on the low end, and 100% on the high end of all humans have gum disease. In no uncertain terms, this means that billions of people have something going on in their mouths that contributes to every known chronic disease. It's kind of incredible. This is why I get up every day. This is why I continue to show 50 to 60-year-olds how to brush for the first time in their lives. So let's get into it. Everybody good on volume? Am I being heard loud and clear? Okay. So I own Seattle's only holistic dental office. What does it mean to be holistic? It means we view and talk about and treat oral health as if it's a fundamental part of overall health, which isn't a specialty or even an eccentric philosophy any longer. It's reality. It's just true. And the science clearly shows that now. What this means in our office really is that we do all the usual procedures a little differently, a little better. On the left here is a safe Mercury amalgam removal procedure I did for my wife. We do biomimetic crowns and onlays. So crowns and onlays are things that fix teeth, broken down teeth. But when you do it biomedically with certain technology, I can literally copy the exact shape of your natural tooth into the artificial material, so it looks and feels the exact same. And on the bottom right, we've got guided biofilm therapy. Biofilm is a technical term for plaque and tartar. We treat that in the office. It also means we provide services you will not see anywhere else. Platelet-rich fibrin, ozone, lasers, ceramic implants, myobrace, cutting-edge stuff. It also means we're reading the latest research and bringing what scientists are learning right now to the dentistry we're doing today. Anyone who's ever had a chronic health problem knows that modern medicine is blind spots. Things like allergy, autoimmunity, Lyme disease, neurodegeneration, chronic pain, nutrition, and even cancer. There are things we are learning about human health right now that could change your life, and you will not hear about it from your doctors for another 20 years. Do you want to heal yourself and your family and your patients with what we knew 20 years ago or what we know today? To be healthy in the modern world, in the modern medical system, you have to be your own advocate. You have to self-educate. You have to read the research. And finally, holistic means any kooky weirdo with their strange beliefs about fluoride, mercury, x-rays, and root canals can show up and safely be themselves. In my office, we will participate in a respectful dialogue about how to treat disease and maintain health in a way that's consistent with their beliefs, no judgment. So an example, right? If a parent doesn't want fluoride, but they or their family are high risk of developing dental decay, that's fine. Teeth aren't made of fluoride anyway. They're made of calcium and phosphate. Easy. Let's load up some whitening trays with MI paste every night. Done. No lectures, no guilt trips. They're happy and healthy. People drive hours over snowy mountain passes, fly in from other states just because we'll talk to them without judging them, without condescending, without making them feel like bad parents. Of all the things I do, kindness and respect are by far my biggest money makers. It's surprising how badly people want and need this from their doctors, and I think they deserve it. So here's what we know. Gum disease is the most prevalent infectious disease on the planet, and it's killing us. Not breathing well at night really messes us up over time. That mercury doesn't belong anywhere in your mouth and is fairly dangerous to deal with. And that root canal treated teeth can harbor totally painless infections full of harmful microbes. So we'll get into gum disease first. This little diagram is in every single textbook for hygienists and dentists. This is the stages, these are the stages of gum disease. And basically this is a process where buildup of bacteria interacts with inflammation of the adjacent gum tissue to cause infections, recession, bone loss, basically to undermine the foundational bone that holds teeth in place. Anyone know what causes this process of gum disease? Anyone know what that off-white stuff is building up gradually as the disease becomes more severe? It's bacteria. It's bacteria, bugs. So a biofilm, which is the technical term for the bacteria that live on the teeth, is a thin, slimy film of bacteria that adheres to a surface. It's an assemblage of microbial cells that is irreversibly associated, meaning it's not easily removed, with the surface and an enclosed matrix of primarily polysaccharide material. So this on the right is a model of oral bacterial colonization, showing recognition of the tooth surface by early colonizing bacteria and co-aggregations between early colonizers and secondary colonizers of the tooth surface. Notice how the secondary colonizers bind to previously bound bacteria. Notice how sequential binding results in the appearance of a new surface that bridge with the next co-aggregating partner cell. Then they all go and secrete a gooey matrix to protect themselves. Protect themselves from what? Everything. Every chemotherapeutic agent and antibiotic you can throw at a biofilm will not and cannot penetrate into an established biofilm and break up this big bad bacterial kumbaya. Not until you physically disrupt the biofilm. So gum disease is what happens when your body's defenses go to war against a highly organized, highly sophisticated, highly evolved cooperative ecosystem of bacteria trying to make their home at your gum line. These are modern bacteria. These guys evolve much quicker than we do. Your body cannot fight this, and it will literally destroy itself trying to. These are prevalence rates of gum disease in various countries around the world. What you see is, like I said before, 50 to 100% of all people have gum disease. This makes gum disease the most widespread infectious disease on the planet. It might just be the most prevalent disease on the planet. Does anyone know of another disease that half of all humans currently have? So researchers notice basically periodontal disease has now been implicated as a risk factor or cause of all the major killers: heart disease, stroke, cancer, diabetes, neurodegeneration, all the stuff that our parents ail from, our grandparents passed from. But notice that I said the word cause. It's a bold statement to state cause scientifically. The correlation between oral health and systemic health is like old news. It's all over the journals and has been for decades now. But what about this sacred word cause, right? How can we know that gum disease causes systemic disease? How about if we treat your gum disease and watch you get healthier? That's exactly what happens. Periodontal disease is caused by inflammation and bacteremia. So these are the ways in which what happens in the mouth affects the rest of your body. Inflammation and bacteria by way of the cardiovascular system. This is the basis for that link. The inflammatory products, tumor necrosis factor alpha, interleukin-6, C-reactive protein, and actual whole live oral bacteria of gum disease are implicated in atherosclerosis. When they biopsy the blood vessel walls of people who have passed from strokes and heart attacks, they find oral bacteria inside that diseased tissue. And where in the body does the vascular system go? Where exactly are your blood vessels? Everywhere, right? Every organ system. We're going to see the damage most in the heart and the brain, but it's happening system-wide all day, every day, as long as gum disease is present. Bacteremia refers to the presence of bacteria in the blood. Biofilm organisms that are attached to the tooth inside the gum pocket exist in close proximity to a rich vascular plexus. And due to this anatomical proximity, plaque bacteria have a ready portal of ingress into the systemic circulation in both health and disease. Thus, gum infections can provide the brain with intact bacteria and virulence factors and inflammatory mediators due to daily transient bacteremias. There's actually so when they biopsy the diseased brain tissue of people who passed from Alzheimer's and Parkinson's, the actual plaques in the brain, they also find oral bacteria, in particular spirochete organisms, which are incredibly common these days. So they're also implicated in neurodegenerative conditions and neurologic health later in life, which is just interesting, right? There's supposed to be a barrier between your blood and your brain, the BBB, and we thought it was impermeable and the brain was, a bacteria-free environment. It's apparently not true. So in short, gum disease feeds your brain a steady stream of spirochetes and other bacteria, our circulatory system, which brings all things good and needed to nourish and repair every part of the system, also carries bad things that do a lot of harm. So we need to do everything we can to minimize the amount of bad stuff leaking into our bloodstream from the mouth. Dental decay. Another prevalent study on decay, which is also caused by bacteria, but this makes dental decay the other most widespread infectious disease on the planet, right? Between nearly 100% of adults and 60 to 90% of children have dental decay. So we have kind of the most important jobs in healthcare, in my opinion, right? But here's the thing, what causes decay? It's acid, and acid only comes from two places on planet Earth: the things you ingest, foods you ingested, drinks you ingest, and bacteria. If you look at this statement from the ADA, it says that tooth structure demineralizes when it comes in contact with acid produced by bacterial biofilm when they eat and what we eat. So the point is biofilm is a important part of oral health, and it has important systemic links. So one thing we see is that the old model of what causes cavities is it's the food you eat and the bacteria that you have. But we really want to know what causes decay, right? Is it the sugar and carbs, right? Is it what we've been told our whole lives? And we can actually run experiments on this. So for example, if we take food out of the equation of what happens in the mouth, we still see decay. And we know this because there are actually mouths, human mouths, that do not eat. There are people who, for medical reasons, have like a feeding tube, right? They have a feeding tube which shunts food directly into their stomach through their abdomen wall, and their mouths never interact with food. People with cerebral palsy can't swallow, so they don't eat. People with craniofacial malformations can't physically chew, so they have these feeding tubes embedded in them, and food never touches their mouths. But what do you think their mouths look like? They still get plaque and tartar. They get gingivitis, cavities, all the same stuff, even though food never touches their mouth, no sugar going into their mouth. So it has nothing to do with eating. It's the biofilm. Biofilm forms on any wet surface given time. It's just a biologic fact. The moment you finish cleaning your mouth, biofilm starts to grow. And if you watch a time-lapse video of oral biofilm growing over 24 hours, at about the 17-hour mark, the biofilm changes from normal environmental symbiotic flora to the parasitic pathogens that cause us disease. 17 hours is what I call the maturation threshold for biofilm formation. At 17 hours, the biofilm basically goes from good to bad. So what do we want? We want young biofilm, new biofilm. And remember, it happens regardless of eating, which means we don't clean our teeth to get the food off. We clean our teeth to reset the biofilm. We want young biofilm. And that's the logic behind twice a day. If you flank your day with a regimen of brushing, flossing, and scraping your tongue, your biofilm will always be less than 17 hours old, and you will eliminate disease in your mouth. Next slide. There we go. So here's a fairly new article, very well done, that compared the cardiovascular health of people who do versus who don't clean their tongue. One of the things they looked at was heart rate variability, HRV. We're learning now that it's less about high and low blood pressure and more about your ability to adapt your blood pressure to the needs of your day. You want it low when you're resting, you want it up when you're active. It turns out people who clean their tongues regularly gain the ability to adapt their blood pressure by an additional 10 points. This means hypertensive people can lower the BP by 10 points simply by cleaning their tongue twice a day. That's not insignificant. That's like taking an antihypertensive medication. The reason for this is that cleaning your tongue regularly discourages the growth of parasitic organisms that derive a benefit from existing on you, but provide nothing to you in return, and instead encourages the growth of bacteria that participate in your nitric oxide pathway, which is a major regulatory molecule of the cardiovascular system. So think of your body like a patch of dirt in your yard, right on the lower left here. If you do nothing to that patch of dirt, what happens to it? All kinds of crap, right? Whatever opportunists happen along will grow them. But if you give that patch of dirt attention on the right, you can fill your garden with plants that you can put in your dinner on your dinner table, and that will nourish your body. And so why such a powerful effect from the tongue? Because quantitatively, there are more anaerobic bacteria on the tongue than the entire rest of your mouth combined. So if you aren't cleaning your tongue, you're growing weeds, I promise. In fact, there are as many bacterial cells in and on your body as there are your own cells. Biologists are actually reclassifying human beings as a superorganism. They're calling our bugs, our bacteria, the other half of the human. Gastrointestinal researchers and microbiologists have now shown that the human microbiome participates in systemic health in a whole bunch of ways. Did you know that there are gut bacteria that synthesize and secrete analogs of human neurotransmitters? You know, the things that tell our brain what to do? So who's really driving, right? Yeah, they're now calling our bacteria the other half of the human. All right, so what happens when we control the biofilm? We eliminate disease. There is no gum disease where the biofilm is controlled. And the only decay you'll see are in people pounding acids in their diet, right? Kombucha all day, lemon water all day. So think about this. If you manage your biofilm and you don't have dental disease, you can basically eat whatever you want. How about that? So when we are performing prophylaxis or scaling and root planing, those are like regular and advanced cleanings, what are we doing? We're basically professionally resetting the biofilm. When you're cleaning your mouths at home, what should you be doing? Resetting the biofilm. Oral health is about resetting your biofilm regularly enough to prevent disease. Understand this. Teach your patients this. So we assess the biofilm in our offices using microscopy. We have light microscopes to look at samples of people's plaque. Basically, we put this on a microscope slide and we can view a live video of your bugs. All those little dots and sticks that are moving around, those are bad bacteria. And if the dentist isn't using a microscope, you're underdiagnosing disease, you're undereducating your patients, and you're not really curing oral disease. This is something that's a standard part of my exams, both the initial as well as the checkups. As you look at your bugs, use this as a baseline, we compare to it over time, we want to see things get better. This is a particularly active slide with a lot of bad bacteria. I'm going to skip this as a little video on how to prepare slides. Don't need to mess with that. And I'm going to go through a few samples of what we find. So we describe what we see based on phenotypes, the shapes and the movements of bacteria. All these little dots that are wiggling around, these are called spinning rods, like bacilli. Next, we've got gliding rods, gliding bacilli, these longer, dark things that are kind of swimming across the fluid. Next are my favorite, spirochetes. Spirochetes I have zero tolerance for. Those are the ones in the studies that show up in the blood vessel walls that cross the BBB and enter the brain and are affiliated with neurodegenerative changes there. So if I see that, which I see a lot of people come in with those, like we have to act fast. We need to go through self-care, education. We need to intervene in terms of gum therapy. Those are zero tolerance infections there. You can also see some of you in there, right? These are white blood cells, which if you've ever studied them, they have a multinucleated appearance. They're really characteristic and easy to see on light microscopy. If we see an overabundance of these, this just tells you that the person has a lot of inflammation. And then this is kind of a generally not good slide. There are every variety of bacteria. And I would say that this is how people's oral bacteria look 60, 70% of the time. So most people, their mouths look like this. And then occasionally we find some pretty exotic stuff. You can find amoeba, which are notable for how they move using pseudopod type extensions. They kind of like blob around. A lot of people who come back from like Thailand, India, traveled over, vacation, will come back with like new little passengers that they didn't have before. Oh, sorry. And then very occasionally, we'll see Trichomonas, which are actually protozoan parasites. We've seen a number of these over the past few years, but anyway, there's a lot of stuff that you can find in the mouth, and this particular bug, which you'll see in a second as we zoom in, is actually an STD.
The very extreme, philosophical mindset for holistic is personally.
And then this is a slide that doesn't have a lot of movement, which is a classic sign of kind of a bad mix of bacteria. Everything's pretty still, but there's still a lot of bacteria. These are called non-motile cocci. And I always tell patients when we pull this slide up, like we don't want to see anything moving. But one thing is that Streptococcus mutans, S mutans, which is the causative agent of decay, is non-motile. So this mouth might have a very healthy periodontium, meaning the gum and ligaments that support them, but that mouth may still be rampant with dental decay. So I never call this a healthy or normal slide. And this is a fairly boring slide. Lower quantity of bacteria. We call this inactive. There's nothing moving. It's fairly boring. You may see a few of the dots and sticks kind of bouncing around slightly. This is called Brownian motion. This just refers to the kind of vibrational motion of static objects in solution when they kind of are met with molecules of water. So it's just a physical movement, not an actual motile movement. Cool. So what is the best plaque sample of all? The best sample is no sample. That's why the slide is blank. If we can't find bacteria biofilm to sample, then you're doing a good job. There are also other ways to evaluate specifically what's inside your microbiome. Some people have persistent infections despite making good changes at home. Because bacteria are social and we get and give them to people, sometimes a patient will be doing everything right, but an infection will still persist. And then we always look to their social and physical environment. So who else might have an uncontrolled infection that they're swapping spit with? So we can do salivary diagnostics. This is like your 23andMe salt water, swish and spit. It does take time to get the results back. It's an extra cost, but this is kind of a high level way of giving a species specific information about what's going on in your mouth. All right, next we're going to get into silver fillings, amalgam fillings. I call them mercury containing or mercury releasing fillings. Basically, the FDA has never done regulatory proof of safety testing on dental amalgam because it's been around so long. However, the FDA admits that dental amalgam releases low levels of mercury in the form of a vapor that can be inhaled and absorbed by the lungs. Does anybody know where it goes once it's in the lungs? The bloodstream. And where does the bloodstream go? Everywhere. So back in 2008, my UCLA professors told me that mercury is mostly released from amalgam fillings when they are placed and removed, and that the daily exposure is not enough to matter. And this remains the official stance of the profession. So these are a few statements about mercury containing fillings. Mercury, so these are, before I say them, every single one of these statements is factual. Mercury is toxic to every organ system in your body, especially the brain. Like that's fact. There's a million things of research covering the problem of mercury and why that's an issue for human health. We do know that silver amalgam fillings contain mercury. That's molecularly part of what it is. We know that mercury containing fillings release mercury vapor when placed and when removed, meaning you're working with the stuff, you put it into place, mercury vapor is actually coming off of that, giving you all an occupational exposure in the meantime, and ditto when they're cut back out. We also know that these fillings release mercury vapor throughout their working life. This is established fact. Any silver filling is outgassing a small quantity of mercury vapor all the time. Also, the moment mercury filling material is removed from your body, so you have an old silver filling, you need a crown, the dentist cuts that out. When the hygienist, not the hygienist, the assistant next to them suctions out that dust, that debris that they've just cut out, that material they've suctioned out is now treated, handled, and regulated as toxic waste because of the mercury in it. And dental offices are the biggest polluters in the world of environmental mercury, which is a public health concern. I think only 2 years ago, Washington State required dental amalgam separators be installed on the suction lines of dental offices. So these are all facts that I have personally verified in the research. The only controversy here is whether there are any adverse health effects from the exposure of mercury you get as a result of having silver fillings. It's kind of the old dental school paradigm of it's not enough to matter, right? But the science is changing, however. It does seem to matter to some people more than others, sure. But think about this. If we know toxic mercury vapor is coming off of these things, and we know this mercury is going directly to the brain, what does it matter how little vapor is getting into my brain? Like, I personally don't want any mercury in my brain. I like my brain. I need my brain. It's an important part of the system, right? Also, is everybody the same? Does every body react the same way to everything? Females are known to clear mercury from their systems better than males. Even the FDA acknowledges that developing brains of babies are susceptible to mercury exposure from dental amalgams. It's this concept of at-risk populations, right? The young, the old, the infirm. Are people with neurodegeneration an at-risk population for exposure to a known neurotoxin? Absolutely. So my general rule is if the health effects are questionable or unknown, find an alternative. My rule doesn't even apply here. The health effects of mercury are unquestionable, so find an alternative. Oh, and check this out. Here's an interesting twist of logic. So you've got all this amalgam in your mouth, right? Perfectly safe. Yeah, there's some mercury in there, but it's not enough to matter. Something happens to the tooth and we got to take the filling out. We drill it out. A mercury-rich slurry gets suctioned out of your mouth and goes into the sewer system, ends up in the rivers, the lakes, the ocean, gets into all the living creatures that subsist in this now toxic environment. The plants, the animals, the fish, our drinking water. Now we're all concerned about dietary mercury exposure and its effects on us. But remember where the mercury came from in the first place, your mouth, where it was living for 3 decades. When it's in your mouth, not a public health concern. When it's in our food and environment, because it was put there after being taken out of your mouth, then it is a public health concern. Interesting, huh? It's kind of the world's deadliest hypocrisy. All right, so root canal treated teeth. I'm going to kind of explain what a root canal is. Root canal treatment, endodontic therapy, is a treatment sequence for an infected pulp of a tooth, which results in the elimination of infection and the protection of the damaged tooth structure from future infection. So basically, if something happens to a tooth, it breaks, it becomes inflamed after dental work is done, or there's just a really deep cavity that has already reached the internal nerve of the tooth, you got to do something about it. And traditionally, dentistry would do a root canal procedure. And that's kind of detailed here. But basically, they clean out the infected nerve, they disinfect the space, and they fill it back up. So why are root canals done? To save a dying or dead tooth, to physically keep it in your mouth. So what changes from here to here? We remove the nerve and the blood vessels. So we now have like a hollow dead tooth living in your face for how long? Years? As long as it lasts, right? Where else in medicine and human health do we leave something dead inside our body? The answer is nowhere, not without dire consequences. So why are we doing this to ourselves? Because at one time we all thought, well, it's better to have a dead tooth than no tooth at all. Fortunately, there are better options now. So this is a series of slices from a CBCT, it's like a dental cone beam, a lot less radiation than a medical CT. These are also known as 3D cone beam x-rays. This tooth right here is causing little to no pain for this person. If the patient notices anything, it's a vague pressure or foreignness, it just doesn't feel quite right. This tooth might even look totally normal on a routine periapical x-ray. This right here, this dark shadow around the tip of the root, basically can only be diagnosed from the 3-dimensional x-ray. This is something we routinely take in our office to evaluate root canal treated teeth. But what is that dark shadow at the tip of the root? That's an abscess. That's a silent abscess. That's an infection embedded deep in the jaw, sitting literally right on top of a major neurovascular bundle. That's an active war zone of bacteria fighting for its life, and it's winning. And everything that's happening in that war zone is getting right into the bloodstream all day, every day, for years. This is kind of like gum disease all over again, only deeper. And why does this happen? What's actually inside this abscess? Even when the highest standards and the most careful procedures are followed, failures still occur with root canals. This is because there are root canal regions that cannot be cleaned and obturated, meaning filled, with existing equipments, materials, and techniques, and thus infection can persist. That's quoted from a research article on this. And what you see on the lower left is basically an in vivo map, cross-section teeth of the actual neurologic anatomy inside of them. It's incredibly complex in a way that modern treatments don't really get into. We can clean the main visible canals. As you see on the diagram to the right, typically we are taught that the quantity and complexity, or in this case simplicity, of accessory canals on the bottom right here is very simple. There's maybe 1 or 2 on a tooth, but actually they're all over the place. So when we do a root canal, we are basically incapable of removing and cleaning everything out. There will be sections of that anatomy that are still contain bacteria that we can't clean out. Because we remove the nerve, you won't know it. You'll never feel any problems there, not until we accidentally catch it on an x-ray, or in my office, we screen for that. All right. So root canal treated teeth are an issue because the persistence of microorganisms is the main reason for failure of them. The microbial flora of root-filled teeth with these, we call them periradicular lesions, those dark spots at the tips of the roots, consist of highly diverse, highly organized, highly complex biofilms. And the health effects of untreated root canal infections are that abscesses, dental abscesses, they share the same cytokine biology as other systemic diseases. There's systemic inflammation mediated by interleukins, there's systemic autoimmunity, oxidative stress, and the oral microbes we now know cross the blood-brain barrier. So to recap, what we have with the root canal tooth is a dead tooth, penetrated with infective organisms with no internal blood supply or immune system because we removed it as part of the procedure, embedded in the jawbone, and they fail. They abscess silently, and we see the same inflammation and bacteremia, right? Bacteria in the blood, as we do in gum disease. In fact, the technical term for a root canal abscess is apical periodontitis, the same clinical entity as gum disease. So it's the same problem, it's the same mechanism of inflammation, and it's the same slow poisoning of the system. While it's true that the research is comparatively new and limited with respect to the health effects of root canal treated teeth, absence of evidence is not evidence of abscess. And then finally, I guess I have some time for this. I'm going to go over obstructive sleep apnea, known as OSA. This is a pretty serious sleep disorder that causes breathing to stop repeatedly and start again during sleep. It occurs when the throat muscles intermittently relax and block your airway during sleep. A noticeable sign of OSA is snoring. That is loudest when sleeping on the back, so it's very positional. Some signs and symptoms are that people who aren't getting a good night's sleep because they're not breathing well are sleepy all the time. The second they sit down, they nod off. There are observed episodes of them not breathing, which we'll see a video of in a second. Like it looks a certain way. They are waking up suddenly. So something that we notice is that they look a certain way when we see them, when we're sleeping next to them. But if we are them, you may not notice anything other than like, I woke up suddenly with a jolt, kind of gasping for air. That would be something that they could experience and report to a doctor. Waking up with a really dry mouth or a sore throat because they've been breathing through their mouth or trying to all night long. Difficulty with concentration, so normal stuff that kids and adults suffer from, could be due to how they're breathing at night. Obvious things like loud snoring, so if they're very loud, like snoring is basically on the spectrum of sleep apnea. Snoring is like they're almost ready to stop breathing. That's what's happening there when they snore. Sweating at night, waking up with a headache first thing in the morning is a classic sign that you weren't breathing well at night. High blood pressure, depression, irritability, all kind of signs of sleep apnea. So I want to show you what it looks like. Obstructive sleep apnea occurs when the muscles in the back of your throat relax too much to allow normal breathing. These muscles support structures including the back of the roof of your mouth, your soft palate, the uvula, the tonsils, and the tongue. When the muscles relax, your airway narrows or closes as you breathe in, and breathing may be inadequate for 10 seconds or longer. This may lower the level of oxygen in your blood and cause a buildup of carbon dioxide. Your brain senses this impaired breathing and briefly rouses you from sleep so that you can reopen your airway. This awakening is usually so brief you don't remember it. You can awaken with shortness of breath that corrects itself quickly within 1 or 2 deep breaths. You may make snorting, choking, or gasping sounds, and this pattern can repeat itself for 5 to 30 times or more each hour all night long. This disruption impairs your ability to reach the desired sleep, restful phases of sleep, and you'll probably feel sleepy during your waking hours. People with OSA may not be aware that their sleep was interrupted. In fact, many people with this type of sleep apnea think they slept well all night long. So what we're seeing here is this gentleman, his chest is trying to breathe. You can see him like spasming. That's his lungs trying to expand to draw in air, but his throat is closed and he cannot breathe. There's no air sounds. All of a sudden, he'll wake up a little and gasp. He breathes for a few minutes. His brain thinks everything's okay, goes back to sleep. You hear the breath sounds decrease and then eventually stop. And then you'll see the effort of his chest again, trying to breathe against a closed airway. He'll do that for a few seconds before the carbon dioxide builds up. His brain says, wake the F up, and he'll gasp for breath again. He's not breathing right now. There's no air coming in or out of him. He's trying. He's drowning. All of a sudden, he gets air. This is a very classic example of what it looks and sounds like, but a lot of people who don't fit the typical male overweight demographic suffer from this. I suffer from this. I'm like 160 pounds and I'm almost 6 feet tall. I'm not overweight. I have terrible sleep apnea. My wife also does it a little bit as well. She's 5'7" and like 110 pounds. Like, it's not who you think. Lots of people suffer from this, and you want to look for those signs and symptoms to evaluate. The health effects of not breathing, I mean, name one, and it's on this list. It affects everything, right? You never really sleep. Your brain is constantly trying to keep the body awake to take enough to take a breath. And the interesting thing about sleep apnea is it eventually damages the exact parts of the brain that regulate automatic breathing. So it becomes a vicious cycle. I did work on this in my undergrad degree. And it turns out, big surprise, that being deprived of oxygen all night, every night, does quite a bit of damage over time, right? These are system-wide effects. So what happens in the human body that can cause this much damage to so many things? It's inflammation. It's all inflammation. So this can be a source of system-wide inflammation that can cause or correlate with or worsen other systemic diseases. This is a little interaction between sleeping, airway, oxygenation, and cognitive health later in life. And ways to treat this, typically there are professional interventions. You can do snoring guards, if you will. You wear something that holds your jaw forward, keeps you breathing at night. Super severe cases have the Darth Vader mask. You might have heard of these from some of our older, family members and stuff. They can be life-changing. For somebody who cannot breathe, a CPAP will change them as a human being. Sleeping well at night for somebody who's never slept well at night is quite an experience. So a few practical recommendations here. Home care, right? Home care is very, very important. Basically, there's a right way to take care of your mouth, and you don't know how to do it because I didn't teach it to you. Nobody's teaching it to anybody. I'm not really sure why. Professional dental care. So there are things here we have to evaluate. What is the status of your gum health, right? Are your gums sick or not? What do your bacteria look like, right? Sometimes you won't have gum disease yet, but you have the infection that'll eventually lead to it. So looking at it under a microscope allows you to catch it early and often prevent worse issues. We want to evaluate your root canals. So if you have a root canal and you have not had a 3D X-ray taken of that, it might be infected. Studies show that between 50, and 60% of all root canals in circulation right now are currently infected, and you don't know it. So you have a 1 in 2 chance, right? And then if you have mercury containing fillings and you're concerned about that, you want to have it removed a certain way. There's a protocol for removing them that is part of an international standard. You can find somebody who's accredited in that protocol to provide basically the protections necessary to minimize the amount of exposure you experience from removing those from your mouth. So if you need a crown on a tooth that has a silver filling, you want to remove that filling as safely as possible so you don't build up mercury in your system. And then a polysomnography, basically a sleep study. If you suspect you might have sleep apnea, you have some of the symptoms I've gone over, or your sleeping partner more likely is keeping you up at night due to loud snoring, and you haven't done a sleep study, definitely do that. Home care, I won't get into this, we're kind of running out of time, but there's a right way to do it. It's part of our hygiene program when you come in for cleanings at my office. And again, full disclosure, I'm a dentist, I own an office. If you believe anything I say, you might end up in my office. I don't need you to, but there is a right way to do it. And I make particular points to make sure all of my patients are educated in best practices. I want you to see exactly what science shows you should be doing in your mouth every day. I'm not going to tell it to you. I'm literally going to show it to you, which tools to use, how often, and specifically how to maneuver those in excruciating detail. Here's a little example. There are no good videos for brushing and flossing online. These are like the least bad ones I've found. Basically, there's a way to do it. There's a way to brush your teeth. None of you are
Small
doing this
circular
correctly,
motion is
except
made with
maybe
the
Jennifer.
bristles into the pocket.
I have to show you how to
Then,
do
the
this.
bristles are
Somebody
swept
needs to show
from
you
the
how to do
gum
this.
line
Some
to
people
the
will be
biting
told this
surface of
by
the
their
tooth,
hygienist. Oh, brush
brushing
near the
over
gum
the
line.
entire
You need
front
to have it
surface.
shown to you. It's
This
a
technique is then
task that
completed on the
requires a
inside
high
surfaces of the
level of spatial reasoning and manual dexterity that really takes time to develop. And dentists and hygienists assume you have the same spatial reasoning and manual dexterity that they have, which is just not true. To do what we do, we have a high level of both those qualities, and we make assumptions about what you're capable of that it does not track with reality. So it's really good to see this done on yourself. Ditto with
and then go
flossing.
down, scrape it up. So you're going to be sliding it down underneath the gum line until you feel that resistance where the gum line stops the floss. Then scrape it up and go down about 7 times on one side of one tooth. Once you get one side of
7
one
times.
tooth done, hug it
More than me, I
intentionally
say
very
5.
closely to the back side of the other tooth. Again, go down underneath the gum line all the way until it stops. You can either go back.
So the point is, there are perfect ways to do these things that constitute self-care. And you need to see them, study them, practice them, and see somebody who can hold you accountable for that. This is how you manage the biofilm, which causes all dental disease. This is how you manage the biofilm that we now know correlates with significant systemic disease. It's just what you do at home and the partnership you have with your professional.
The brush.
All cavities are caused by acid, by the way. I didn't really get into this too much, but there's a lot to be said for managing cavities, even when you're managing biofilm, the things you eat, whether you're taking lots of medications. Some of my more advanced age patients are on lots of medications for various comorbidities, and most of them have as a side effect xerostomia, dry mouth. If you take one or more medications that have that as a side effect, the mouth dries out very, very much. There's not a lot of saliva to go around, and saliva is massively important to how healthy your teeth will end up being over the years. So that was what that slide was. Other than that, again, checking in on the sleep study. If you experience or your partner observes loud snoring that just disturbs your sleep or wakes up others, loud gasping or choking at night, pauses in your breathing during sleep, excessive daytime drowsiness, you want to look into this. Lots of people have this. You wouldn't expect. It's way more prevalent than you think. There's actually a great place you can go called Sound Sleep Health, which does telehealth consults for sleep studies now. Super convenient, really, really awesome. So that's it. That's that's a quick overview of kind of the main issues that I see that I think are important to health, right? Gum disease and managing your biofilm. Making sure you check on your root canals if you haven't yet, and to do that periodically, even if they check out the first time. You want to watch those over the years because they can fail at any time. Looking out for those mercury fillings. If you've got silver fillings, those are releasing tiny amounts of mercury into your system. If you're young and healthy and you feel fine, don't worry about it. Most of who finds their way into my chair are going to be older people with lots of like chronic health issues, or even young people with like weird chronic health issues that they don't really understand. They haven't had a lot of help within mainstream health. They're seeking out alternative modalities to address and improve their quality of life. And in those cases, they want to make sure there's just nothing going on in their system, in their mouth, that might be contributing to what they're dealing with. But mercury is no small thing. If you've got it, be careful with it. If you're going to remove it, do it properly. Keep your brain safe.
Thank you so much, Dr. Beard. There was a question that I got. If someone has had a root canal done within the last 9 months and they still feel pain when they tap it or touch it, is that normal? Is that something to be concerned about?
So 5% of root canals fail initially. Mm-hmm. And this is something that many specialists that do the actual treatment they don't talk about it. If it feels comfortable, in their minds, it's fine. If it doesn't feel that comfortable, give it time. We'll do an adjustment. If it continues, we'll retreat it. Not every root canal is successful. You have to check it. My specialist will do a 6-month evaluation for this very reason. He'll do the treatment. Maybe the tooth needs a crown. He won't let me touch it to put the crown on it until 6 months later after he sees it for the second time. It should look perfect. It should feel perfect. If it doesn't, there could be something going on. And you want to be in the hands of somebody who's going to be really conscientious about that diagnosis, who's not going to call something successful that doesn't feel successful to you. So I would look into that for sure. And that's not an uncommon experience. Again, 1 in 20 people, 1 in 20 root canals, they don't feel comfortable right afterwards, like because you're not done yet. Not sure if that answers the question. Yeah,
that's great. Thank you. I got another question, more logistical. Can we get a copy of the recording? The recording will be sent out as long as you were registered for this. If you weren't registered, then go ahead and send me a direct message and tell me, and I'll add you to that email. Any other questions? Great, another question. And right before I ask that question, just in case, as I know people might have to leave for 1 o'clock, I am putting the feedback survey in the chat. It will also go out by email, but please fill that out. Let us know what you thought. If you have other ideas for programming you'd like to see, we'd love to hear that. If you also do the feedback survey and leave your email, you will be entered for a holistic dental kit that we're giving away in LiveWell that includes a tongue scraper, some biodegradable floss, some other goodies. But so our other question was, what are your thoughts, Dr. Beer, on coconut oil pulling?
Yeah, so oil pulling is extremely time consuming and the benefit is fairly minimal. I really recommend oil pulling for people who already have a stabilized microbiome and stabilized dental health generally, meaning your energy and time is definitely best put elsewhere. Although lots of my patients anecdotally report liking it, noticing differences, so they do that. But to my knowledge, to oil pull properly, you have to hold the oil in your mouth for like 15 minutes per sitting, which if you do it multiple times a day is like a lot of time. And there are other things you can do, I think, more effectively in less time that will result in greater net benefits to your oral health generally. So it's good. I just don't think it's the most helpful thing you can use your time and energy for.
Awesome. Please feel free to keep submitting questions. Another question we got, as far as a dental hygiene routine, which aspect of a dental hygiene routine do you feel like is the most important? Like if you're on a rush, and you can only do one part of your dental hygiene routine, like what is it?
My favorite question, cleaning your tongue. Most important part of your mouth that contains the most bacteria quantitatively and the worst mixes anaerobically is the surface of your tongue, in particular the back part of your tongue near your taste buds. I didn't go over it here in the demo, but yeah, tongue scraping is powerful, not to be neglected. If you do not currently scrape your tongue, you need to. I'll send you all a tongue scraper. Like that's the most important thing that you can take away is to clean your tongue. Second is definitely going to be flossing. Flossing clears biofilm between the teeth where nothing really gets. Not just your brush doesn't get there, but like your tongue, your cheek, your saliva doesn't penetrate there as well. That's where you typically accumulate a lot of anaerobic bioburden. So flossing is another thing. Like I never skip. I never skip my tongue. I never skip flossing. Occasionally in a bind, I won't brush, but I'll at least do the other two things. So it's kind of weird, but like brushing is scientifically the least important thing. However, let me qualify that. The job is not really done until you do all three. All three, brushing, flossing, scraping the tongue, all of those are necessary to reset the biofilm in your entire mouth. For example, if you neglect a single tooth, everything else is clean perfectly, but you leave one tooth with a biofilm that's now older than 17 hours, the organisms on that tooth will re-inoculate the entire rest of your mouth, not in 17 hours, but in 2 hours. So it's important to be thorough. It's important to do it all. But if I have to pick, that's the order I do it in.
Great. Another question about acid reflux. Knowing that acid can cause problems in the mouth, if you have acid reflux, are there like extra precautions one should take? Can that lead to increased risk of gum disease?
Yeah, it mainly leads to an increased risk of dental disease, so dental decay. If your teeth are sitting in an acid bath all night long, you're going to accumulate a lot of damage on the teeth that your natural saliva healing regenerative capacity is going to be overwhelmed by. So one, other than getting after the root cause, right? Like getting in with, this is another thing, like acid reflux. They medicate you, go home, don't come back, right? If you go to a more alternative practitioner, they're going to have a lot more to say about why that's happening, like a naturopathic doctor, for example. And that would be, I think, worth getting into if this is really affecting your quality of life or your dental health. But an easy crutch to use is to do what are called remineralization trays, which I talked about at the very, very beginning of the day today. Basically, these are trays, clear aligners that look like Invisalign if you're familiar. They're a little thinner, a little more comfortable. And most people will put like whitening solution in that to keep their teeth bright and white between cleanings. But you can also put anything you want into that. There's lots of antimicrobial gels. You could put coconut oil if you want. In the case of acid reflux, I'd recommend putting a mineral paste inside of it. MI, the letters M and I, which are prescription paste, is my favorite. If you can't get access to that, simple mineral toothpaste like Boka, B-O-K-A, can be put in that in a pinch. And basically those trays will hold minerals in solution in contact with your teeth and root surfaces all night long, which is typically when reflux can affect you. So you can wear remin trays, mineral trays at night to protect your teeth.
Awesome. And then last question, it's a question about other popular things. So like gargling with hydrogen peroxide and or like water flossing, like how do those kind of fit in?
Yeah, so water picking, water flossing does not replace flossing. It was marketed as such. Dentists and hygienists alike, for those of their patients that won't pick up a piece of string, will like, that's okay, just water pick. In my experience, it does not clean between the teeth like it should. It'll blow out lots of debris and chunks. It'll seem effective, but there'll still be a sticky coating between the teeth that, in my experience, can only be removed with floss. It's the only way. If you already floss and brush and scrape your tongue and those are good, adding water picking does help. It just, it's more cleaning of the same areas, but it's really an adjunct, not a surrogate for proper flossing. Rinsing with hydrogen peroxide, and it must be diluted to 1.5%. The brown bottles you get at Target are 3%. Too spicy for the mouth. You want to cut that in half with water. 1 part water, 1 part 3% gets you 1.5%, which is the safe dilution to rinse with up to 5 times a day. Be careful with this though. If your saliva pH is low, something I check on in my office, or you generally deal with a lot of cavities, do not use hydrogen peroxide. Its pH is a little bit acidic. And when we have acid issues, decay issues, we want to stay away from acidic antimicrobials like peroxide, which is a powerful, and it's my favorite antimicrobial for gum disease. But if they have active decay, we're going to just use regular baking soda water or something pH balanced like closest. So a different rinse would be used for peroxide if you deal with cavities. Otherwise, go nuts with it. It's great.
Awesome. All right. Thank you so much. It is 1 o'clock, so that is the end of our time. I want to thank you so much, Dr. Beer, for coming and sharing your expertise and knowledge with us. And thank you all so much for attending this program. Again, please fill out your feedback survey. We will email out the recording, and yeah, just let us know what you think. Always here for you all. Thank you all so much for taking time out of your day to learn a little bit more about your dental health.
Thank you, everybody. Bye.